healthcare industry is in the midst of an identity crisis. Unlike most identity crises, our healthcare industry is not struggling to know itself or what it does well. It is literally struggling to know who its patients are. The healthcare industry is overburdened with the task of correctly matching patient identities across health information transactions. And there's a lot of these information transactions. These transactions occur both internally within a healthcare provider's information system and externally when private health information needs to move between two or more health or even financial information systems. Every time you walk into your doctor's office, the first thing they do is ask your name. This is a way for them to match your identity to the form of identity their internal information system needs. They need to know they have the right medical record pulled up on their computers. And within this same episode of care, they will need to match your identity again and again. They'll need to match it again, for instance, when they receive your lab results from the external lab company via the lab's external information system. It's important. They need to know they got the right results tagged to the right patient. Most all of us have heard horror stories about healthcare experiences where medical information was not at the right place at the right time. And everyone wonders why, in this age of digital information, we keep hearing these horror stories. The innate inaccuracies that we encounter when matching patient identities is the root cause of these problems and much of what ails healthcare information. This task is historically labor-intensive, prone to much error, carries a high risk of causing malpractice or breaches in patient privacy, and generally gums up healthcare billing, administrative, and IT systems. Consequently, this task of matching and verifying patient identities within and across IT systems is costly and permeates every episode of care for every patient. The root cause of this problem is ultimately healthcare's lack of a way to directly identify patients. You see, current methods of assessing a patient's identity rely predominantly on the use of inexact demographic vectors, such as your name or date of birth or billing address. Unsurprisingly, these kinds of identifiers are by their very nature inexact. They change from time to time, like when you get married or you move. And they really only ever identify a real person with statistical certainty. It's all based on probability. This reliance on demographic indicators produces patient identification error rates to the tune of 5 to 10% of the time at least in almost all health information systems. This error rate is unacceptable to healthcare providers. They have zero tolerance for patient identification errors. These errors injure patients. These errors kill patients. These errors carry enormous administrative costs to muddle through and clean up. To cope with this problem of correctly identifying patients, the healthcare experience as a whole is burdened with layer upon layer of systems and jerry-rigs and workarounds which seek to avoid costly patient identity errors. To fix these problems, what is needed is a way for healthcare information systems to authenticate a patient's identity with exact identifiers, especially across health information transactions involving two or more parties. The Universal Patient Index does this. It is able to do this by indexing all the exact identifiers a patient is known by and associating them in a foolproof, undiscoverable way using the Undiscoverable Association Protocol. See our video on the Undiscoverable Association Protocol to learn more about how it functions and retains its undiscoverability. By utilizing the Universal Patient Index, a healthcare information system can match a patient's identity and link it across a health information transaction without relying on the probabilistic accuracy, or lack thereof, of inexact demographic patient identifiers. This need for a Universal Patient Index to authenticate patient identities across healthcare transactions is well documented in both the health IT and health management literature. As recently as February of 2018, the New England Journal of Medicine published an article on their website claiming developing a unique patient identifier system would have many benefits. When accurate information is attached to the right patient, data access is timelier for clinical, administrative, quality improvement, and research purposes. Inappropriate care, redundant tests, and medical errors are reduced, and health information exchange becomes easier, within organizations as well as between. Identifiers are also beneficial for patient mobility, allowing information to be linked to patients and following them as they move. The RAND Corporation discovered that the lack of a universal patient identifier prevents the healthcare system from achieving full automation and connectivity, and its full clinical, public health, and research potential, because it is dependent on non-ambiguous linking of patients and records. It is even estimated that effective private health information exchange between healthcare providers would realize over $77 billion a year in efficiency cost savings alone, and potentially double this figure in terms of improved clinical outcome and safety. Authenticating and linking patient identities across healthcare information transactions is essential to many core healthcare functions, such as billing, private health information exchange, and procedure authorization. Authenticating patient identity is of utmost importance to ensure patient privacy rights are observed when private health information is handled by healthcare providers. The Universal Patient Index does all of this, and with the Undiscoverable Association Protocol, does it with sovereign patient privacy. For more information on the Universal Patient Index, the Undiscoverable Association Protocol, or sovereign patient privacy, click on the links here, or maybe here, or visit our website at www.calibrateblockchain.io.